got Dr. Tim Failing from Upstate Family Chiropractic down there in Herkimer. We're going to be discussing things for lower back pain, herniated discs. Anybody with general back pains, you may want to stay tuned. We've got a lot of interesting things we're going to be discussing. Hey folks, we are here now with Dr. Tim Failing. I don't know, we do this.
Yeah, I don't know what we can do lately here.
We shake.
We got about 5 feet here.
But we're going to do the show now with Dr. Tim Failing from Herkimer. Now, what's your address down there?
It's the address for GPS be 108 South Bellinger Street. That'd be the GPS address.
It's right there. There's the Vinny's Pizzeria is right upstairs, State Street. There's Verizon. He's right there.
I'm on the lower level.
Lower level in the back. You know, he's been my chiropractor for quite a while now, too. I got to get back with you, too. I didn't know you were open.
Yeah, I stayed open right through the whole COVID thing because
like us, I didn't know.
People needed it. You know, they were coming in.
Yeah, so... But when I was going down there, he was explaining to me about this new thing that you got going on. You know, that it's for a new type of therapy. Is it for
spinal decompression?
Okay.
Non-surgical spinal decompression for herniated and bulging discs, primarily. People who have conditions like sciatica, degenerative disc disease, some neuropathies and such like that. That would apply to them too.
Now, are you the only one in the area?
There's another one in Niagara Falls, from what I understand.
So that's quite a ways.
It is. Actually, before that one in Niagara Falls came in, I actually took care of a patient who got a car accident in Canada. He drove down to Herkimer, stayed over in a hotel. I took care of him, and he would go back and do that every week, and it worked phenomenal for him.
Okay. Now, what kind of issues? Major spine. Now, you were saying something about what's the weight loss thing?
That's another whole thing that we do with far infrared light. Obviously, weight loss is tough because you got to get the person on board to want to lose the weight. It's kind of like smoking. If you really don't want to,
got to be on the program.
You got to want to lose weight and change your lifestyle. You know, if you're just going to get on the lights, you can. We use the red lights also for pain control, and it works well for like other issues like that, like injuries.
Okay.
But it helps to shrink the fat. It's like turning it from a grape to a raisin. But you can turn it right back to a grape if you're not doing the right proper eating stuff out there. You know, so but it does help shrink the fat cells. It liquefies them so that you can get it out of your system.
Do you have to be on a regimen for like the pills and?
Yeah, there's the supplements that we use because we try to use more of it's more of a detox with that system because your body will hold the fat, and if you don't detox it, it gets held in. So you got to make sure your liver is clean and your lymph system is working well. Otherwise, you can just reabsorb it and it goes right back in. So we want to make sure we can flush it. So we do that also. That's another little wrinkle we have in the office too.
I know, I've seen that. So let's explain a little bit about this.
Yeah, we do a non-surgical decompression. I was the first one in New York to have the machine. I've had it quite a long time. I just do it for my select patients. I'm not really pushing it to any other clients that are out there, but it works primarily for herniated discs and bulging discs. Most people who have a herniated disc, they get around 86, 87% success with it, which is high.
I got 3.
See, most people have it, live with it. 70% of the people on the street with absolutely no pain have a herniated or bulging disc. They just don't know it. They haven't aggravated it yet. Once they do, then they start looking into what happens. You know, you do therapies, you do medications, you do your chiro, you do PTs, you do all these things, acupuncture, and which we should be doing. We should do everything we can short of surgery before surgery. Because if someone goes and does get surgery done, most of the surgeries won't allow you to get this done afterwards. So it's kind of, you have to do it in a progression.
How many steps?
The machine, the person would be on the machine. There's nothing else required besides them coming into the office and getting on the machine for about 27 minutes. And most patients are taking a nap.
And you don't even really
Most of them are sleeping, you know. Most of them are sleeping. Because what happens with it is a disc is avascular, has no blood flow. So once a disc is injured, it can't heal. So when you look at a disc, you're looking at a disc. A normal disc would look like this. You'd have 2 vertebrae. The disc is here, the shock absorber between it. The nerve comes out of the hole on the side. And it has room in there, but there is a fatty cushion that protects it. So there is something holding it there. And then the back hinges here, called facets, let you move. Well, if they get stuck one way or the other, it rubs and causes friction, and that causes swelling and bumps the nerve. Can't have swelling.
And that's what the pain is.
That's where most people get numbness, tingling, pins and needles in the legs, or they go down to their knees. But we can't have swelling, so in the spinal structures, we never heat it. We only ice it. Only ice spinal structures. You can heat the side muscles and things and get away with it, but don't put it over the structure when you're dealing with a spinal problem because it's going to bring blood there and get more swelling. But when you're looking at a disc, it's a little more specific. The disc looks like a jelly donut, so the inside is fluid filled.
Okay.
So what happens is this fluid is like throwing a rock in water. You throw it in, it hits, and it evenly distributes the forces all around that perimeter around the outside. The outside is called annulus fibrosus, and it's kind of like grizzle on a steak. It's hard,
Right.
so it contains that fluid. But every so often, that fluid will get pushed too hard. If you jump too hard, you take a big fall,
Right.
and it'll rip through the outer surface, and it'll bulge or herniate there.
That's actually a bulge.
That's a
right
bulging
there.
and herniating disc. Now, it's not going to float away typically. That could happen. In 27 years, I haven't seen it, but it can
Right.
happen. It's a possibility. But what you're looking at typically is this nerve has this much room as there's swelling to move out of the way.
Right.
This side only has a little bit. So it still has room to live and work. But when you get any kind of swelling in there, it's going to aggravate it because of this, what they call a space-occupying lesion. So what we do with the machine is we put the patient on the decompression, check their weight, get them on. We have to qualify for it. Some patients may not qualify depending on their MRIs or x-rays that I look at. Right. So I review those first to make sure they're a candidate. Once they are, we get them on the machine, and what the machine does is, since a disc doesn't have any blood flow, it can't heal. But around the body, there's interstitial fluid that bathes the body. It has stem cells, it has amino acids, proteins, so it can pull all that in and help it heal. So the machine will open up the disc space. I'm going to exaggerate so you can see. It'll open it up, and then every minute you're on it, it goes and pumps it down without closing it completely, and then pumps it back up. So it does move every minute up and down, and it's like thinking of you take a Ziploc bag, push the air out, seal it, and if you try to pull that Ziploc apart, it sucks in on itself. Right. That's called a vacuum phenomenon. It's pulling in, it's trying to pull, but it can't because it's sealed just as this is. So when we're doing that position, we're doing just like that Ziploc. We're opening it, pulling the interstitial fluid, the nutrition around the disc, back in to help it heal. I had a patient early on. He had a CAT scan of a herniated disc, did all the 18 treatments that we typically do. Right. He got a post-CAT scan and it was clear. So that can happen, but I don't usually run into a person who has one herniated disc. Everybody who's coming in, they got 3 or 4.
I've got 3, 4, and 5 from weightlifting years ago, and basically just crunched them out. But is there a difference between the bulging? What if you blow that right out? There
is a potential for blowing it. If that happens, that's immediately a surgical situation. I haven't really run into that. I mean, they're out there. I haven't run into it.
So mine is probably I'm pretty sure mine
Yours
is
is probably,
bulging.
you usually get a combination of bulging and herniating. So usually what happens, we have 5 lower vertebrae in the back. The lowest one usually takes the biggest beating. Some people will go up above, but usually the lowest. And then when that one gets injured, it recruits the other one to help out. And now we got 2 after a while. And then those ones can't do it all, and then they recruit another one. So that's why it's like a domino effect. You can't just say, okay, I got a 1 herniated disc. Let me go to the surgeon. Let me get it repaired, and I'm done. Well, it's not over with because now this is going to work harder even though this was done surgical, if you did well. So we want to still, even after someone gets surgery done, we want to keep this one in motion so it can stay as healthy as possible, and you never got to run into that again. So it's a little step that we should take a little further. But the orthopedists we have in the area are very good. So when I get to the point where somebody just can't get past what they have, we refer to them. We work with them. No matter which group there are, there's a variety of different groups, and we just work with them, and the patient gets comfortable with them.
Now, insurance. Is insurance.
This is not covered in the state. Just like, when you go get like the teeth thing, right. The implants, it's just not a covered service. The company obviously gives us literature, but they say that the orthopedists lobbied against it. I'm not so sure that happened. It's FDA approved, but insurances don't want to pay for hardly anything anymore. Currently, I'm running an ad in Facebook that you can call the office, and I'll still give the ad from the office too. And it's a heck of a deal. We're doing $47 for 2 visits, and it's usually around $100 a visit, and we do about 18 visits. So patients will spread it out. They'll pay a little bit, each week or whatever, and make it easy for them. But we're going to give them more information because there is some nutrition that we like to give them, to offer them. There are a few items that are really beneficial that can help you internally. So if you're going to be pulling that fluid in, you want to have good nutrition in that fluid to pull it in. So some of the things that we would think about would be like nitric oxide, turmeric, which a lot of people have heard about. It's very popular. Yes, and turmeric's really good for an anti-inflammatory systemically. So we use those couple items, and we always like to look at vitamin D because of autoimmune problems. This is a situation of healing, so we want to make sure your vitamin D level is good. And there's no sense guessing. You get your blood work done, we get your vitamin D level, and we know where you're at. It goes from 30 to 100 in the blood. We want to be at least 40, 50, 55 in that range, a little higher than 30, so that we can definitely do the healing that we need. People with autoimmunities, a little bit different scenario. We talk about that when we get to that person.
Now, is there an age limit for getting in this machine, or can a child?
I never really had a patient come in that had a youngster that had a herniated disc that they were that concerned about it.
Right.
I'm not saying it wouldn't, because idealistically, if anybody in our society found that they had a bad disc, and you got to strengthen it with exercises, you got to keep it motion with activity. But this would be the best thing. You jump on it right off the get-go.
Right.
Obviously, everybody should be doing it, but it's always a cost consideration. I haven't had any of the youngest. The youngest I have had on it was probably about 22.
Right.
But most of these people get disc problems from activity. I do have currently a gymnast who's potential.
Right.
She's around 12. I'm just looking into it. We're going through the process because you got to jump through hoops for MRIs and all these things now. Right. It's a little bit difficult. You got to go through all that. But we're getting there. We're going to figure it out for her and give her some options, because this is a management thing. Now, it used to be years ago, your doctor was, the one you went to and he told you what to do. Now everybody's on Google and everybody's figuring everything out.
Yeah,
so you're kind of your own doctor.
Yeah, I was going to say
right.
They're trying to be their own doctors.
So if they're going to be their own doctor, they want to have somebody that they can, bounce things off of, that can give them a logical explanation, or send them in a direction that they can kind of see what they're looking for. But again, nothing that could be harmful. Like if I go get back surgery, I mean, you get plates or screws,
right.
or you get the cages or the things that they offer. Sometimes that's where they got to go. That patient is not a candidate for the machine. So
right.
there's not even going to be I wouldn't even put them on
See,
it.
and I don't have nothing in my back. It's just the soreness in my back. So probably I would be.
Well, while you're younger,
Okay.
like, the disc situation, when it's an early injury, early years of the disc, you don't get a lot of degeneration. The degeneration comes after 5 to 7 years. You start to see degenerative disc disease, the arthritis and stuff. So when these vertebrae aren't moving because they're injured, and the one above it or below it is moving more, it's like a glass of water with salt in it sitting on your counter. The salt will settle out.
Right.
So the minerals in here, if it's not in motion, will settle out. So if my arm's in a sling and doesn't move for 8 weeks, I'm going to get a little arthritic built up, because the calcium and the magnesium minerals are going to be deposited on the bone.
Gotcha.
That lacks mobility over time. It limits your range of motion. So what we need to do is we need to keep those things in motion. In your situation with 3 discs, all right, and like I said, I haven't had 3, I haven't had anybody with like 1. Everybody's got multiples. But being used in the machine for such a long time, what I would do, so if there's 5 levels and you got the last 3 that are in trouble, I can actually be very specific on it. I can just pick the 4th one if that's your worst. I can pick the 3rd one and skip the other 2. Yeah. I can also pick the 5th one and treat all 3 while you're there and give them some extent of treatment too. You may need a little bit down the road later to just maintain. And I tell patients, once they get done with the machine and they're doing very well, I offer them a maintenance where they can come in at a reduced rate to maintain, like once a month or once every 3 weeks, or whatever works for that patient. But just to say, well, I put air in my tires, never need it again.
Right.
You always got to maintain it, because we're always active. We're always busy. We're not in a
Our
bubble.
bodies are like vehicles. Our bodies, you need to treat them well.
Yeah, we're constantly using them.
If you treated your vehicle horrible, what's
Yep.
going to happen to your vehicle?
Yeah, if I get a 60-year-old vehicle coming in that's clean, no rust,
Yeah.
that thing is pretty nice. You don't see those.
No.
And we beat on our bodies every day.
I know.
I don't care what the position is. If someone's at a desk job all day, they're going to get neck and back issues. If they're a farmer, boy, they got some real bad
Firemen.
stuff. Firemen, yeah, policemen,
Running
all
over
these
here.
guys. The situation that's unique, though, is that the cervical spine and the lumbar spine are kind of brother-sister. So being that you have a lower back disc problem already, that can lead to a consequence of having a cervical disc too, because they work together. The curves are consequentially together. So in the spine, we have a certain amount of curves that form like a spring. So when you lose one, it straightens out, and then the rest have to work harder, and they can become compromised too. So when I do get patients who have a lumbar or a cervical, I always kind of let them know that we always got to be aware of the other areas too, just to be aware.
Wow, that's a lot of information, So folks, you want to get a hold of Dr. Tim Failing here, and there's his phone number right there on the screen. You can say the phone number.
315-866-3646.
And anybody that has back issues, or you just want a chiropractic stuff, you want to just give the doc here a call, and he'll take care of it down there right there in Herkimer. Like I said, I've been going to him for quite a while now, so.
And we get patients from all over. They aren't just local for this, because like I said,
all
this
over
is-
the place.
yeah,
If
come
you're
from all
watching
over.
this, you want to give them a call, check them out, and look up this information on this new on this interesting procedure.
Very interesting machine, yeah.
It's great.
And you'll put a picture on so they can check it out, and we'll get a link or something for
Yeah.
them. Okay?
Yeah. So.
Not a problem. Thank you very much.
Thanks,
Appreciate
Dr.
it.
Tim. Okay, and folks,
Wonderful.
give Dr. Tim a call, and again, we hope to see you soon down here at Dr. Uniforms. We'll see you later.
Bye now.
Bye.